aware, I issued a ministerial direction to implement the pay recommendations for 2025-26. That has been referred to the Executive for consideration and decision. The decision has not yet come. I've raised the issue at several meetings. 2 weeks ago I stood in the Chamber. I was quite optimistic. I'm not just as convinced today, but let me be clear, if we don't act soon, there will be strike action. I understand the Royal College of Nursing has a key meeting this Thursday, which will, I would anticipate, rubber stamp strike action.
Thank you, Minister. Colin McGrath for supplementary.
Thank you very much. It's obvious that we are dithering in terms of delivering this payment for our nurses, which was promised to them, and the frustration amongst nurses is absolutely palpable, to the point that they're going to strike and have a detrimental impact upon our health service because they can't get the money that is owed to them. The Minister says it's the responsibility of the Executive. The Executive says it's the responsibility of the Minister and the Finance Minister, and nobody is paying our nurses. For openness and transparency, when will we see the payment for our nurses?
Minister.
Thank you, Principal Deputy Speaker. I hope the member recognises I cannot answer that question because my Permanent Secretary has made clear to me that we do not have the funds available, hence the ministerial direction. I have to say, I disagree with the term dithering. I think every minister and every executive department is struggling badly with their budget allocation, and that has an impact on service delivery right across the board. But I have to say, if it's paying our nurses, our doctors, our health and social care workers, surely in a list of priorities, that must be number one.
Call Fulton McGuigan for supplementary.
Prevlas Can Collier, and I just want to echo the Minister's comments that it must be a priority that our healthcare workers get their pay. Further to the issue of nurses and doctors, in January, Minister, you stated that you would ensure that social care workers would receive a real living wage, and I think that the deadline was September. Can I ask, Minister, when social care workers who have had to wait for a long time to see this commitment, when will they see their pay?
Minister.
Thank you, Principal Deputy Speaker. A very valid question from the Chair of the Health Committee. I did indeed commit to the real living wage for social workers from September, so we're through that deadline. That has unfortunately become part of the mix in terms of how we address what is currently a £600 million shortfall funding gap within the Department of Health. Real living wage, I understand to be a commitment at executive level, and I have discussed at executive level whether my colleagues want to prioritise honouring the real living wage commitment or perhaps delay the social work real living wage until the start of next financial year, which would put some £25 million towards that £600 million shortfall.
I call Donny Donnelly for supplementary.
Thank you, Deputy Speaker. There is real frustration out there among healthcare workers who are left out of pocket again. So will the Minister commit to prioritising pay awards within his budget for 26-27 to avoid the repeated delays in healthcare workers receiving their money?
Minister.
Well, Deputy Speaker, I'm certainly very much open to doing that as we move into a multi-year, presumably a 3-year budget. What I would say to the member is, if we do that, and we will certainly run it as an exercise, that will then, and we'll have to make a best guess at what the pay bodies will recommend, because the budget will come ahead of next year's pay award recommendations. We then have to see what services and what impact it will have in terms of health and social care delivery, but I am very much positively minded to what he's suggesting.
Jerry Carroll for supplementary.
Thank you, Deputy Speaker. Minister, it's concerning to hear they're not optimistic about resolving the issue of the pay demands. Can you detail, Minister, why this happens seemingly every single year and why pay parity isn't automatically accounted for in each year's budget?
Minister.
Well, Deputy Speaker, just to be clear to Mr Carroll, I am less optimistic than I was a couple of weeks ago, but I still think it's going to be resolved, because even if it does lead to strike action, and I pray to God it does not, at some point this pay issue will have to be resolved. And I think if we allow it to go to strike action, it will have an impact on service delivery, it will have an impact on waiting lists, it will have an impact on staff morale. And the bottom line is, when it is resolved, it will cost more than it would cost to sort it out today. Why does it happen year on year? I think, despite the fact that there's £8.4 billion in the budget, it is not sufficient. And what we need to do is reform how we deliver health and social care so that we can be more efficient, which will make those pay awards more affordable.
Keith Buchanan.
Question 2, please.
Minister.
Thank you, Principal Deputy Speaker. Within the Mid-Ulster area, mental health services are provided by both the Northern and Southern Trust, as well as community and voluntary groups. Both trusts provide community mental health teams and teams who look after the mental health of older people. Within the Mid-Ulster Hospital site, patients can access crisis resolution or home treatment services, community addiction services, access to perinatal mental health services, psychological therapy services, and, where appropriate, the regional trauma network. A recovery coach with lived experience offers one-to-one sessions, and an opiate substitute treatment clinic operates once a month in Cookstown. The Recovery College and Bereaved by Suicide services are also available locally, while a CAMS team is based in Magherafelt to care for our younger population.
Thank you, Minister. I call Keith Buchanan for
Thank you, and
supplementary.
thank the Minister so far for his answer. Minister, several people in Mid-Ulster have followed advertisements on television, which are the right thing to do, and reached out, but they didn't get the help they needed, and then the help came too late. The answer you just gave me, has there been any improvements from the answer you gave me in this past number of months, or is that what's there, or has been any improvements in the service? Because whenever they reached out, the help wasn't there.
Minister.
Thank you, Principal Deputy Speaker. I believe I've given the member quite a long list of services that are available in that local area. I think that the people the workforce who deliver those services are extremely committed and dedicated. But as with most, if not all, of health and social care, capacity is currently outstripping demand. I don't see that ending anytime soon. And the focus also has to be on demand, and the Department will, before the year is out, the calendar year is out, be looking at ways in which we ask the public to look at the demands that they are putting on the health and social care service.
Call Patsy McGlone for supplementary.
Minister, you quite rightly outlined a significant list of services being provided. I'm sure the member opposite will also agree with me as getting access to those services in time is the issue, and that's not indeed any querying the people who are delivering those services, who are very good at what they do. But the question that I would ask is, can the Minister confirm whether the 10-year mental health strategy is being properly funded, or whether Mid-Ulster communities indeed are being let down by underinvestment?
Minister.
Thank you, Principal Deputy Speaker. I thank the member for his comments. The mental health strategy was published alongside a 10-year funding plan. That funding plan outlined that over 10 years, £1.2 billion was needed to implement it in full. So the direct answer to the direct question, is it being funded in full? The answer is no.
I call Sean Mulholland.
Deputy Speaker, and thank you, Minister. Something that would, I think, greatly improve both the services in Mid-Ulster but also right across the Northern Trust is obviously the construction of Birch Hill Centre within the Northern Trust specifically for mental health. Can you give us an update on the funding position for that, or the timeline for that mental health provision in the Northern Trust?
Minister.
Thank you, Principal Deputy Speaker. I say to the member that I've been to Hollywell, I've looked at the plans, and indeed there's a kind of mock ward that you can walk around and view. It is a world-class facility that is being planned. Can we afford to fund it? I don't know the answer to that, because we have yet to see the capital budgets released from the Department of Finance. When we do, we'll have a better idea. But I have to manage expectations and say to the member, it is a very costly project, and to do it on the timeline that currently exists is very doubtful. I would anticipate there could well be a delay, perhaps of a year, maybe even more. So I just want to manage the expectations. But the current facility is not really fit for purpose. It's way past its use-by date. And so that's just one of the many, many challenges that we're facing in terms of our capital build.
Claire Sugden for supplementary.
Principal Deputy Speaker, I suppose to go further than what you said, Minister, I understand the plans at Birch Hill have actually been paused with no date of them starting. So how are you increasing capacity in other units, such as the Ross Thompson and Coleraine, given the shortage and the wait list that exists in those units?
Minister.
Thank you, Principal Deputy Speaker. I would assure the member that thought is being given to alternative arrangements in the event that Birch Hill does not go ahead. as planned. I can tell her actually I was at a meeting in that regard as early as late this morning. However, I wouldn't want to go into detail at this stage because I don't want to raise false expectations.
Call Robbie Butler.
Question number 3, Madam Principal Deputy Speaker.
Minister.
Thank you, Principal Deputy Speaker. I'm pleased to say the Department is steadily increasing investment. Firstly, 15 additional places at the Open University in 2019. In 2021, 10 more added, bringing the total to 285 per year. Since then, I've secured additional investment to further increase social work training places. In September, we commissioned 163 places at Ulster University, 127 at Queen's, 54 at Open. That's a very significant total of 344, the largest number commissioned to date, and that's from a baseline of 260 in 2019.
Thank you, Minister. I call Connie Egan for supplementary. Sorry, Robbie, for supplementary.
Connie's one of my favourites too, but we'll keep that between us. Thank the Minister for his answer, and the Minister will know that social work is very close to my heart, particularly in around children's services and looked after children. The Minister has given us good news today in terms of those training places, but those training places need to be transformed into paid work opportunities. Is the Department and the Minister any update in regards to those employment opportunities for those trainees?
Principal Deputy Speaker, I'm pleased to say we have. We've been very successful in recruiting newly qualified social workers into trust vacancies, and that is particularly in the past 3 years. My department continues to work closely with senior managers in the Trust. We're developing a recruitment process for social workers that is both quick and efficient. It's resulted in almost 700 newly qualified social workers taking up posts in Trust services since June of 2023. That is an unprecedented number, and we'd hope to repeat the mass recruitment of newly qualified workers in the coming years in order to bring some relief to workforce pressures.
Daphne Connie Egan for supplementary.
Thank you, Principal Deputy Speaker. Minister, would you agree with me that the reason for so many vacancies of social workers is many of them feel there's a bureaucratic overburdening of them? And could I ask what your department is then doing to ensure that they can have more face-to-face time with their clients?
Minister.
Thank you, Principal Deputy Speaker. Well, I think one of the other issues is the real living wage, and I'm very keen to secure that in terms of social work. In terms of bureaucracy, I would just make a general point to the member. I think health and social care can be a very complex area to work in, but I am very much of the opinion, and I've stated this from almost at the get-go, that we have overcomplicated how we deliver health and social care. So any moves we can take to remove bureaucracy and make it simpler to deliver would be welcome.
Parisha thought we removed democracy, Minister. Anyway,
That's
Nicola
my
Brogan.
secret.
I know. Nicola Brogan.
Question number 4, please.
Minister.
Thank you, Principal Deputy Speaker. Secret's out, obviously. So, like across other areas, the Western Trust continues to experience significant demand for autism assessments. Latest figures, I'm afraid, show just over 3,000 people are awaiting assessment, and that includes 2,517 children. The Trust currently complete around 420 children and 50 to 60 adult assessments each year, so it's a huge mismatch between demand and capacity, and of course the result is growing waiting times, some people now waiting over 3.5 years for assessment. I fully recognise the impact delayed diagnosis can have on individuals, also on families, and I am committed to trying to reduce these waiting times.
Thank you, Minister. I call Nicola Brogan for supplementary.
And thank the Minister for his answer. But for 3,000 people to be waiting on autism assessments is really, really stark, and such stress on lots of families. Can I ask the Minister to give an indication of how autism assessment waiting lists compare in the Western Trust to other trusts in the North, and to outline what he's doing to ensure that children and adults in West Roan and the Western Trust are treated fairly?
Minister.
Thanks, Principal Deputy Speaker. The Western Trust undertook a waiting list initiative last year, and that delivered 20 additional assessments for individuals who are approaching 18 years of age. They're planning to use identified non-recurrent investment this year, and that should help deliver a further 13 assessments, and that's across both children and adults. Their autism services for children, young people and adults maintain highly efficient processes for organising clinics and appointments. and all assessments follow NICE criteria and vacant posts are filled as quickly as possible. So I hope that is some assurance to the member that her trust is doing what it can in this area.
Thank you, Minister. I call Alan Robinson for supplementary.
Thank you, Principal Deputy Speaker. Minister, what advice do you give today from this House to all those families who will be potentially waiting years for such an assessment from the Western Trust?
Minister. Thank you, Principal Deputy Speaker. I would say to them that while the waiting lists are not what they should be, the services are of a very high quality. Some people say to me that health and social care is broken. I do not agree with that, but I do accept that some of the pathways and access into health and social care are very badly damaged. And I would just assure them that autism is on my radar. It's within my community, my family community, if I may put it that way. And so it's not as if I'm unaware or uncommitted to trying to do what we can to tackle these waiting lists, which are really quite shocking.
Thank you, Minister. I call Daniel McCrossan for supplementary.
Thank you, Speaker. Minister, in the US there's trials going on with autism medication. I don't know if I'm pronouncing this right, Leucovorin, and it is proven to have a very positive impact on children, particularly non-verbal children with autism. Is there any exploration by your department in relation to that medication here?
Minister.
Thank you, Principal Deputy Speaker. I'm unaware of that medication. I'll certainly take that away and ask the Chief Pharmaceutical Officer and other senior colleagues, and we will get back to the member.
Thank you, Minister. I call Doug Beattie.
Question 5, please.
Thank you, Principal Deputy Speaker. Members will be aware that perinatal and paediatric pathology services are provided through a service-level agreement with Alder Hey Children's Foundation Trust in Liverpool. That's been the case since January 2019. I accept it's not the preferred service model, but I want to assure the House it is delivering in a timely, sensitive and appropriate manner. My department commissioned an evaluation of that service, which was completed earlier this year by Queen's University Belfast. The work was supported by my department and the Public Health Agency, as well as by stakeholder representatives, including SANS and Cruse Bereavement. The report contains 21 recommendations aimed at improving the service and care, including enhancements to reporting, communication, clinical education and follow-up for parents. I have accepted the 21 recommendations and these are being actioned.
Thank you, Minister. I call Doug Beattie for a supplementary.
Thank you, Principal Deputy Speaker. First of all, I welcome the fact that the Minister and his department have accepted the 21 recommendations in full, but could I ask the Minister some further information on the options of potentially offering families access to less invasive approaches to post-mortem?
Deputy Speaker, thank you. Yes, I think this is an area that I'm very keen that we explore, because there are developments which could be of great benefit to families going through such a traumatic time. It would involve using imaging and other approaches rather than a full post-mortem examination. I should stress it's a relatively new approach. It's used in a small number of specialist centres, but I'm keen to understand the feasibility of adopting these approaches here in Northern Ireland if it can mitigate the need for remains to be transported over to Alder Hey. I've asked for a task and finish group to consider the feasibility of non-invasive and minimally invasive techniques. I'll provide further advice as it emerges.
Thank you, Minister. I call Neil McAllister for supplementary.
Thank you, Deputy Speaker. Minister, this is a very, very difficult and sensitive subject, and I don't know if you're aware, but in our hospitals here, in some of them, there isn't even dedicated space for doctors and nurses to be able to tell families that their little one has died or the way in which they passed away, or for families to be with their young in very limited circumstances. It might be a small number, but it's very, very important. Minister, could you commit to looking into that issue and the capacity of our health estate so that parents can have space to grieve and that doctors and nurses feel empowered to actually give them the information and support that they need?
Minister.
Principal Deputy Speaker, I agree with the member. It is an incredibly sensitive and potentially traumatic moment for families, and they certainly should have dedicated space where their privacy and their dignity is respected. I know I have visited some of these areas in some of our hospitals. I know I have answered written questions on the facilities that are available, across Northern Ireland. If the member has specific hospitals or specific health facilities where that doesn't happen, I would encourage her to write to me, and I can use that, but I will separately task officials with a full review across Northern Ireland.
Thank you, Minister. I call Kelly Armstrong. Thank you, Kelly. Minister.
Thank you, Principal Deputy Speaker. My department is very aware of the challenges facing the South Eastern Trust in providing ear, nose and throat services. The Trust has had difficulty in recruiting consultants in recent years, and in July of 2025 there were 3 vacancies. And to address that, my officials have been working closely with both Belfast and South Eastern Trusts to develop a Greater Belfast ENT service. I'm pleased to advise this collaboration has recently secured the recruitment of 4 new consultants, and in time they'll provide significant additional capacity into the wider Belfast and South Eastern catchment area.
Thank you, Minister. Kelly Armstrong for supplementary.
Thank you, Principal Deputy Speaker, and thank you, Minister. I could have saved you from getting up to give me that answer because I received it in writing at 14:48. But Minister, can I ask what actions that you can provide to support those children who are waiting for an ear, nose and throat specialist for 180 weeks, given the fact that these children are now heading into school and are going there with deafness and their development and their communications is falling way behind?
Minister.
Thank you, Principal Deputy Speaker. I do accept that the waiting times for services and for treatments are extremely frustrating for patients and for their families. I'm just trying to assure the member that my officials and I have been working to address paediatric waiting lists, to modernise and to standardise practices and pathways right across Northern Ireland. The Belfast and South Eastern Trusts have a validation exercise underway. Those lists are being amalgamated. As well as validating lists, the exercise also involves consultants, clinically e-triaging referrals, and that's to determine if the referral requires to see a consultant in outpatients or whether they could go directly to surgery, directly to diagnostic tests, directly to audiology, or to another professional, or indeed should they be returned to primary care where they might be managed by primary care with advice. It means only those patients who need to see an ENT consultant will remain on the waiting list. So it's a standardisation of clinical pathways. It's being implemented by the Belfast and South Eastern Trust, but indeed right across Northern Ireland. So we're doing what we can.
Call Donny Donnelly.
Question 7, Minister.
Thank you, Principal Deputy Speaker. I want to acknowledge that this is key, and I do so with pay on the agenda, which is clearly the headline in the Court of Public Opinion. But everybody should have a reasonable expectation of career progression during their time, and the evidence very much suggests that is not the case for Band 5 nurses.
Donny Donnelly for a supplementary.
Thank you, Minister, and thank you, Deputy Speaker. Minister, I'm sure you would agree that workforce retention is at the heart of safe care. Do you accept that the ongoing delay in the winter preparedness plan will have an impact on staff retention levels? And can you commit to when this will be published, given that it was promised in August, then September, and we're now well into October?
Minister.
Thank you, Principal Deputy Speaker. I share the member's frustration with the delay in the winter preparedness plan being published. The fact of the matter is I saw a draft and I wanted some work completed on the draft. I am very optimistic that it will be published this month in October. I am not sure I agree with the member that the delay is having an impact on staff morale. I think we're way ahead of where we were last year, but are we in the right position? And again, to manage expectations, we are not simply looking at making everything right this winter. That is an overly ambitious position to take. And some of the proposals that have come out of the big discussions that took place this year may not see the fruits returned this winter, but I think it is important that we look at short, medium and long-term actions that can be taken to relieve those additional winter pressures.
Thank you. Before I call David Honeyford, can I just remind members that their supplementary questions need to be related to their primary questions, not something completely different. David Honeyford.
Thank you, Principal Deputy Speaker. I want to see an expansion in specialist nurses and advanced nurse practitioners because this will improve patient care. It will reduce waiting lists, those waiting lists for both assessment and treatment. I have visited primary care surgeries where advanced nurse practitioners are having a really magnificent and positive impact. Additional funding has been identified through the Elective Care Framework Implementation and Funding Plan, and this will help increase the numbers of specialist nurses, particularly in the areas of cancer and urology. Other specialist nursing areas, including advanced nurse practitioners, will be considered, but that's subject to the consideration and approval of fully costed business cases.
David Honeyford for supplementary.
Thank you, Principal Deputy Speaker. I want to see as an interesting answer to that. I want to see Santa come at Christmas, but it mightn't actually happen. Minister, you've parties been in control of this department for many years. When will we actually see delivery and actually see waiting lists driven down?
Minister.
Thank you, Principal Deputy Speaker. We actually have increased numbers. So I think this is just a party political point by the member.
I call Michelle Guy.
Question 9, please.
Minister.
Thank you, Principal Deputy Speaker. In the last 12 months, 2,142 patients have been removed from the vascular varicose vein outpatient waiting list due to a change of criteria, with 976 patients remaining. Now, I want to recognise the disappointment for those patients who were removed. However, the fact many patients had been on the waiting list for a number of years is evidence in itself of the pressures and the demands experienced within the service. Similar to other services, waiting times for vascular surgery are lengthy and sadly growing. In 2022, the Department of Health updated the effective use of resources policy following a review of the current evidence-based commissioning position across a broad range of procedures and treatments. Subsequently, certain procedures are only commissioned in Northern Ireland for patients who meet the criteria.
Michelle Guy for supplementary.
Thank you, Principal Deputy Speaker. Minister, that 2,000 patients have been removed from this waiting list due to a criteria change is very concerning. And I can evidence that through one of my own constituents who has really painful varicose veins. She was on a waiting list for 4 years and then was removed due to this criteria change. She was then re-referred by her GP, who then was declined again to be put back on that waiting list. So can I ask to get an assurance from you, Minister, that changing criteria is not being used as a tactic to reduce waiting lists whilst not actually treating the patients?
Minister.
Thank you, Principal Deputy Speaker. I would assure the member that the National Institute for Health and Care Excellence, NICE, their clinical guidance CG 168 informed the effective use of resources policy for the treatment of varicose veins, in addition to a range of stakeholders, both clinical and non-clinical. NICE interventional procedures guidance was also considered. So further to the direction outlined in 2022, due to the current pressures, a decision was taken in 2023 that assessment and treatment could only be provided to patients with severe varicose veins.
Linda Dillon is not in her seat, so I called Stephen Dunn.
Principal Deputy Speaker.
Thank you, Principal Deputy Speaker. A costed model has been completed which estimates that just over £5 million of recurrent funding is required to deliver a 24/7 service. This funding could deliver up to 160 additional procedures every year and increase capacity in other areas such as stroke and interventional neuroradiology. My officials are currently developing a strategic outline case to refine this estimate further. But it's important to note the current financial challenges my department is facing. Following approval of the final budget for this year, my department was left with a funding gap of over £600 million. In this context, and while I remain committed to a 24/7 thrombectomy service, I'm currently unable to allocate the required additional funding.
Thank you, Minister. Stephen Dunn for supplementary.
Thank you, Principal Deputy Speaker, and thank the Minister for his answer and his recognition that it is a real issue, and it is a real issue of concern locally within my own constituency, with more than 2,000 being stroke survivors. Given that thrombectomy is most effective within 6 hours of a stroke, can the Minister outline how he will address the inequality in treatment for those unfortunate enough to have a stroke outside of current treatment hours, and also how he could tackle the regional variation locally?
Less than 30 seconds, Minister.
Well, I thank the member for his supplementary question. The Hyperacute Stroke Project Board is currently leading the process which will identify the optimal configuration for any future hyperacute stroke services in Northern Ireland. We've worked with the University of Exeter on this. I think given the current financial pressures, we have to take a forward-looking and strategic view on how we deliver these services in future.
The time for list of questions. We're now moving on to topical questions to the Minister for Health, and I call Colin McGrath.
Speaker, Minister, in June we learned that the new maternity hospital in Belfast could be delayed by up to a further 28 months or more. So in the interest of openness and transparency, can you now tell us when that hospital will finally open?
Minister.
Principal Deputy Speaker, thank you very much indeed. Some weeks ago, a number of options were put to me in terms of how we fix the water issues at the maternity hospital. I was not content to simply accept the advice that I was given, and so I asked the Trust to commission an independent review of their advice. That has now completed, and indeed the independent reviewer concurred with the option that the Trust had come forward with. So they are now in the design phase, commissioning the design for the remediation work, which will include a separate water system for the neonatal unit, where the most vulnerable babies will be. So it's incredibly important we get that right. That is the reason, the chief reason why it is going to take so long to complete. I have asked officials to take a look at a phased opening to explore whether there are services that could be started in this new hospital before it is fully open. I have not had a definitive answer to that. I've had certain services ruled out, but there are some that are still in play. And again, I was discussing this as early as lunchtime with the key officials. So I'm remaining optimistic that we will see some services rolled out on a phased basis.
Thank you, Minister. I call Colin McGrath for a supplementary.
Thank you, Principal Deputy Speaker. As you've mentioned, Minister, in light of the recommendations from the Belfast Trust, you said that their reputation was in the gutter and requested that a further review take place. That further review concluded that the Belfast Trust recommendations were sound and that their governance is acceptable. So who was it that got it wrong? Was it you that got it wrong, the Trust that got it wrong, and did we actually need the delay that has been caused by getting the additional review and the cost of that in place as well, given that it's changed nothing?
Minister.
Principal Deputy Speaker, thank you. I think just for clarity, I don't think any review that I have commissioned has caused a day's or a minute's delay in the process, because even when I said I wanted an independent assessment of the preferred option that came from the Trust, they were told, they were given permission to go ahead and plan the design phase as if this option was going to be confirmed, and it now has been confirmed. So they have been working on that. Whose fault? There's another report looking at the timeline, and that's not complete. And I put a lot of store in that. I am hopeful that that will answer the member's question about where if there's a finger of blame to be pointed, that report will come up with it. I asked officials to go away and ascertain at what point that report will be complete, because there have been some difficulties with compiling all the information and all the evidence, and the member may know that. And if I may just, in terms of, again, managing expectations, when I talk about a phased opening of the maternity hospital, it is, if there is to be a phased opening, it will be ambulatory services only.
Thank you, Minister. I call Connie Egan.
Thank you. Minister, September was Gynaecological Cancers Awareness Month. Would you be able to commit to updating cervical screening information to make it clear that it does not detect ovarian or any other gynaecological cancers, as was the case in England of July this year?
Minister.
Deputy Speaker, thank you very much. I consider that to be quite a technical medical request, which I'm not sure that I'm equipped to answer, so I would commit to the member to take it away, and maybe in the supplementary should be as specific as possible about the information that she seeks.
Connie Egan for supplementary.
Thank you, Minister. I am concerned that Target Ovarian Cancer have found that 50% of women in Northern Ireland think that their cervical smear test will detect ovarian cancer. Would you then be able to commit to meeting with me and Target Ovarian Cancer to discuss this further and other action we can take to improve outcomes for women who are diagnosed with ovarian cancer?
Minister.
I can certainly make that commitment, yes.
Call Doug Beattie.
Thank you, Principal Deputy Speaker. Could I just ask the Minister if his department has carried out any assessment of the use of potentially harmful alternative medical drugs to suppress the effects of puberty that are not covered by the puberty blocker ban?
Minister.
Thank you, Principal Deputy Speaker. Well, I think it was essential to secure the indefinite ban on the supply and sale of puberty blockers to under-18s. It was based on expert advice, which very clearly cited the insufficient evidence of the safety and effectiveness of those puberty blockers. I would be concerned at any efforts to try to bypass that by using alternative medical drugs, especially those based on very little medical foundation. And one of the reasons that I've gone for a gender service is speaking to families of young people who were on or wanted to be on puberty blockers and saying, because the service doesn't exist except in name, you are effectively forcing us to go and seek out international providers, and there's absolutely no safety regime that we can put in place to guarantee the safety of those medications.
Thank you, Minister. I call Doug Beattie for a supplementary.
Thank the Minister for his answer. Minister, Singapore-based Gender GP are promoting alternatives to puberty blockers online, which may well be harmful to very vulnerable individuals without GP's prescription. Could I ask the Minister, is there anything his department can do in consultation with others to address this?
Minister.
Thank you, Principal Deputy Speaker. That's the exact point I was trying to hint at in my first answer, and I'm not sure if the organisation, the Singapore-based Gender GP, is the same as this one, but as I was working my head around the puberty blocker ban, I was made aware that there was one prescriber who I believe was Spanish, a native Spaniard, but based in Romania, but prescribing through Singapore. How on earth do you exercise any quality control or safety over that? So, as with all medications, it's particularly important to take great care when buying medication online. Many websites are selling medicines online, and they're based overseas. They're not regulated by the UK authorities. Sourcing prescription medications from unauthorised sources will significantly increase the risk of getting substandard and fake medicines. A direct answer to the member, my department's Medicines Regulatory Group works with partners across government and policing to combat the unlawful trade in medicines. The Medicines Regulatory Group monitors online channels for evidence of illegal activity. It takes proportionate enforcement action, and I'll ask that the content of Gender GP is reviewed with immediate effect.
Thank you, Minister. I call David Brooks.
Deputy Speaker, and I thank the Minister for his answer so far. Can I ask the Minister, in light of the UK Government now mandating GP surgeries in GB, or certainly in England, to allow access to online booking of appointments throughout the day, whether he has any plans to do the same here?
Minister.
Thank you, Principal Deputy Speaker. The member will be aware that the BMA GP committee is in dispute with my department over contract arrangements for this current financial year. I would, on that basis, wish to try and encourage that committee to come back and start talking about next year's contract and also about my desire to introduce a neighbourhood model which will undertake that shift left that I talk about putting care as close to people's front doors as possible. So I don't want to be saying anything prescriptive today that might discourage the GPs for re-engaging.
Thank you. I call David Brooks for supplementary.
Well, look, I thank the Minister for his understandable response, and I look forward to seeing his plans come forward. I noted the BMA's concern over the risk of patients facing harm or serious issues being missed. would you agree with me that there can be few systems worse than the current system, by which we have an 8 a.m. lottery with patients having to ring 700 or 800 times?
Minister.
Principal Deputy Speaker, thank you very much. I'm not aware of the 7 to 800, but the principle is that access is not what it should be. As a matter of principle, I think online has a very important part to play going forward. I was in Sheffield and London looking at examples of this neighbourhood model, and there is no doubt that online triage is a thing and seems to work well in the GP practices and primary care networks that we were looking at. So I do see that as a matter of principle as being part of the future, and I think it would be, as a matter of principle, it would be fantastic if people are able to go online and book an appointment maybe the next day or the next week if it's a non-urgent case.
Trevor Clark's not in the seat. I call David Honeyford.
Thank you, Principal Deputy Speaker. This is absolutely not party political, but according to the auditor, your department has poured £2.5 billion, that's billion with a B, into IT systems over the last 3 years alone, including all the overruns and failure. What has actually changed for patients and staff as a result of spending that amount of money?
Minister.
Well, thank you, Principal Deputy Speaker. The member will be aware of Encompass, and this is a new electronic patient record, and it's now rolled out across all 5 of the geographic trusts, from northern to southern, western, southeastern Belfast. The potential for public health initiatives from trapping that data is absolutely immense. Now, in terms of a working practice for an individual, you mightn't notice much at the moment, but for some of the doctors, the clinicians and the consultants that I meet on a weekly basis, some of them have said that they've been working in healthcare delivery in the health and social care system for 2 or 3 decades, and this is the best thing that has ever happened. So yes, it is extremely expensive, but it is also not just the future, it is now the present. And as people get more and more used to it and the functionality within it, it will switch from simply being an electronic patient record for an individual patient to becoming a magnificent tool for delivering public health initiatives at scale.
Thank you, Minister. David Honeyford for supplementary.
Thank you. It's £2.5 billion. Can you give me a concrete example of where this IT system actually allows you to realign resources and take away back office stuff and put more doctors, nurses and consultants and frontline staff in to actually address waiting lists and address the needs of our constituents?
Minister.
Thank you, Principal Deputy Speaker. It's an electronic patient record. It's doing away with paperwork. That frees up efficiencies. It's not designed for what you've just said you want to see.
I call Andy Allen.
As we've already had alluded to here today, there have been various issues which have arisen within the Belfast Trust in the recent past which have impacted on public confidence. Can the Minister outline what steps the Department have taken to restore public confidence and to ensure that there's an early alert mechanism in place that the Department are made aware of issues?
Minister.
Thank you, Principal Deputy Speaker. On the last point, just to assure the member, there is an early alert system in place, and it's not just for the Belfast Trust. What I have done is I have put them into the intervention framework level 5, which is the highest level. I have sent in 2 experts, one clinical, one an expert in organisational culture. I have just received their interim report and hope to have a verbal briefing on that tomorrow. The member will be aware that Jennifer Welsh took up post as Chief Executive on the 1st of the month. And we are in the process of beginning to advertise for a new chair of Belfast Trust. So I think that combination of measures and interventions by myself and the department will yield fruit, and part of that fruit will be an increase in public confidence in what is delivered by the Belfast Trust.
Andy Allen for supplementary.
Thank you, Principal Deputy Speaker, and can I thank the Minister for his answer and the intervention that he and the Department have taken. Minister, you'll be aware that I recently corresponded with you on behalf of a constituent regarding issues pertaining to public or transport within the Trust, and there does appear to be an issue there that hasn't been rectified. Will the Minister commit to meeting with me and my constituent to better understand those concerns, and indeed with the Belfast Trust, as I know it's not directly within his remit?
Minister, you have 10 seconds.
Oh, well, in that case, Principal Deputy Speaker, I suppose the answer has to be yes.
Thank you. Thank you. That ends topical questions. Andrew, you have a point of order.